I'm going to start with the investor's thesis around how we will transform the American healthcare system. As you all know, we've passed several pieces of legislation that will, in my opinion, fuel this investor's thesis. The first piece of legislation actually happened within 2 months that the president took office. It was our Recovery Act. And as many of you know, the Recovery Act was emphasizing how do we get people back to work. But the president included in the Recovery Act a portion of funds that would actually serve as the foundation for economic growth in sectors of the economy that hadn't seen the kind of breakthroughs that we've been looking for. So he put a down payment on healthcare reform by calling for the digitization of the nation's healthcare system through the High-Tech Act. $28 billion of investment to be spent over the next 5 to 7 years to get hospitals and doctors to move from a paper-based record-keeping system to a digital record-keeping system. But that was not sufficient for the investor's thesis to convince all of you to come in to what we believe to be a billion-dollar industry. We followed that up with the Affordable Care Act. You might know this as health reform. Health reform meant a lot of things to a lot of people, but to entrepreneurs, I would like to highlight some of the most important provisions. Chief among them, the fact that we've provided the tools to the administration to once and for all shift the American payment system in healthcare from one that focuses on volume to one that focuses on value. And in a capitalist society, you get what you pay for. As my friends remind me, if you incentivize volume, you're going to get a lot of visits, a lot of procedures, a lot of activity. What you're not going to get are things that are not counted in volume, like care coordination, advising folks to stay healthy, making sure that they stay out of the emergency room. In volume, that would be a negative factor. You'd actually be disincentivized. But as we move the healthcare system to one that focuses on outcomes, quality, or value, you start to open up a market for new products and services. As we look at the Affordable Care Act, we've got several bites at the apple. First, Congress has provided some explicit authorities to launch tests for new payment systems right now. Programs called medical homes and accountable care organizations and bundling payments and readmission reduction programs. What these programs basically do is to say to a provider or a group of individuals that form a provider collaborative that if you can keep someone healthier, keep their quality up, and treat them better at lower cost, you get to financially benefit in that program. We'll augment your traditional mechanisms for reimbursement with a bonus payment, if you will, because you were able to keep someone healthier. Now, think for a moment about today's healthcare system. The provider is reacting to the patients who call to schedule a visit. And they work the schedule. And the software companies that have been very successful are those that have made scheduling better. And contrary, you want to make billing better because once you schedule and you visit someone, you want to get paid for the bill. So we have a great and robust market for products that schedule and bill in healthcare. But if you are to shift the system to focus on value, you start looking at the patients, you start looking at the list of patients that are in front of the doctor, and you ask the question, of the 2,000 patients that you treat, which 30 do you want to see today? Because they're most likely to need an intervention, a hospital admission or a surgical procedure or something that's a bit more on the acute side in the near future. Imagine the technologies one would need to shift the schedule around from people coming into you to you proactively reaching them and inviting them into the clinic so that you could treat them. You need much better data mining tools, care coordination tools, patient engagement tools, Tools that provide decision support so that the decisions you make when you refer them to another provider are done focused on value and quality. Those products and services have not had the business case or an investor's thesis heretofore because they were not reimbursable. Today, now that the law has passed, we are starting to see this new market come forward. Entrepreneurs who previously might have focused on the consumer web are now wondering, hey, wait a minute, maybe I could apply those concepts in keeping people healthy. What if I shifted my focus to join a startup whose mission objective was to keep people out of the hospital, keep them healthier, and make billions of dollars along the way? We would say, hallelujah. You deserve to be a billionaire. But could you imagine being a billionaire and solving the healthcare crisis at the same time? I'll take you for lunch in the White House mess. These innovations need a market that allows them to scale. And one of the provisions of the Affordable Care Act that allows us to do this is a very interesting provision that says if we can demonstrate through pilot tests and programs that these new payment models have led to a better healthcare experience to our seniors, the Medicare Department and the Secretary of Health and Human Services has the legal authority to scale that payment model throughout the entire reimbursement system without having to go back to Congress. That's giving investors more confidence that their products, which they believe in their heart, will fuel this value-driven healthcare system, that they have a chance to see the revenue model, the business case come to fruition. Complement this change in payment. Remind you that I mentioned the fact that we're digitizing the healthcare system. And now look at two other phenomenon. Number one, the medical records that are in the doctor's office that are moving from print, from record-based, from paper-based to digital. We're now developing interoperability standards so that that information can be liberated so that entrepreneurs, in a safe, secure, privacy-oriented way, can start to understand that information and put it to use. And it turns out Washington has a ton of data on how we instrument the healthcare system that's been locked up in proverbial vaults for far too long, but as part of our open government initiative, we are liberating at no cost to the taxpayer, at no cost to intellectual property constraints, so that entrepreneurs can have that information and use it to build new products and services. In fact, on June 9th, I would invite all of you to a webcast at the Institute of Medicine where we'll celebrate the best and the brightest of these startups who are taking this open health data and putting it to work to build the healthcare delivery system of the future. All of this is available for you today, health.data.gov. And it's not just the information that's in the government's vaults. We're actually compelling the sector to publish more quality data and even some patient satisfaction data. I learned, for example, we have in our database whether or not a patient slept well at night in the hospital. Tina, do you know which hospital has the best customer satisfaction in this community?
I don't.
Well, we have that data for you. One of these entrepreneurs is going to go in that database and they're going to grab it and they're going to say, Tina, we're going to provide for you a map to the most customer-friendly hospitals in the community. Because it's freely available and they're going to have fun doing it. So this is the investor's thesis in healthcare. That as we shift the payment system, as we liberate data, both from the provider level and from our public sector in terms of open data, that we can fuel new products and services that will make a ridiculous amount of money and solve our nation's healthcare problems at the same time. Wouldn't that be nice?